I'm Professor Brian Saunders, and this is my colleague Dr. Rameshshanker, and we're from the Wilson Unit for Endoscopy at St Mark's Hospital in London, the United Kingdom. It's a great pleasure for us to introduce to you our paper, Endoscopic Cuff-Assisted Colonoscopy versus Cap-Assisted Colonoscopy for Adenoma Detection. St Mark's Hospital has long had an interest in the efficiency and quality of colonoscopy. In recent years, the key performance indicator that has come to light is the adenoma detection rate for individual colonoscopists. The reason for this is that there is a clear correlation between adenomas detected and the risk of post-colonoscopy colorectal cancer. So the better we perform at detecting adenomas, the more likely we are to protect our patients from colorectal cancer. So any devices or aids that assist with adenoma detection, or indeed polyp detection, because we know that certain lesions such as sessile serrated polyps are equally as important as adenomas in cancer development. Any devices that help us to detect polyps are going to be an advantage or a potential advantage. And in recent years, we've had experience with two different devices. One is the endoscopic cuff, which has these arms which hold the folds back, and the other is the endoscopic cap, which sits on the end of the scope and helps to hold the folds down, allowing a more panoramic view of the colonoscopic mucosa. And both of these have been shown to be advantageous, but we wondered which was potentially better than the other, what the advantages were, what the disadvantages were, hence the conduct of this study. So Ramesh, tell us about the methodology of the study.
So it is a prospective randomized tandem study. It is performed in a back-to-back colonoscopy. So both procedures were performed by 3 experienced gastrointestinal fellows. Each of them has completed at least 1,500 colonoscopies prior to the commencement of the study. So the participants from routine symptomatic care were randomized either to undergo endocuff-assisted colonoscopy first, followed by a cap-assisted colonoscopy. On the other arm, cap-assisted colonoscopy first, followed by an endocuff-assisted colonoscopy.
So these were routine patients with not as part of our bowel cancer screening program?
Yeah, that's correct. They are not a screening population, or they are not part of FIT stool test or FOBT stool test positive patients who are adenoma rich population, as we know. The current cohort were referred from the community for a colonoscopy, either with change in bowel habits, rectal bleeding, or the common indications for colonoscopy.
So tell us about the results. What were the main outcomes?
So the primary outcome of this study is to compare adenoma detection rate between both devices. The first striking difference was the endocuff-assisted colonoscopy showed a superior adenoma detection rate when compared to cap-assisted colonoscopy. The ADR for endocuff was 29% as opposed to 9% for cap-assisted colonoscopy. The more pronounced effect was observed for diminutive polyps, and which was statistically significant. However, for smaller polyps and adenomas or polyps more than 1 centimeter in size and sessile serrated polyps showed improvement towards endocuff. However, they failed to reach statistically significant levels.
So were there any problems associated with the devices?
In our trial, we did not experience any complications such as mucosal aberrations or displacement of those devices, which was previously documented in the other trials. In endocuff arm, slightly over 5% of the patient, we have to remove the endocuff in order to complete the procedure due to the fixed nature of the sigmoid colon. However, in cap-assisted colonoscopy, it was an advantage. We were able to complete all procedures while the cap was mounted to the tip of the scope.
So was there any difference in procedure time, insertion time?
Significant difference in the cecal intubation time with endocuff-assisted colonoscopy, which is a median of 1 minute quicker than the cap-assisted colonoscopy, but the withdrawal time was significantly prolonged in endocuff-assisted colonoscopy by about median of 2 minutes. I think we have a potential explanation for why this withdrawal time was longer in endocuff-assisted colonoscopy, because a large number of polyps were detected during the endocuff-assisted colonoscopy procedure when compared to the cap-assisted one. 58 polyps was detected with cap-assisted colonoscopy and 82 polyps were detected and removed for endocuff-assisted colonoscopy. So I think we could safely say endocuff-assisted colonoscopy actually improve your efficiency of your colonoscopy in our trial.
Thank you, Ramesh. So I think we've shown in this trial, we've added to the knowledge on quality of colonoscopy and in improving adenoma detection rates. The cuff does appear to give improvements in terms of ADR, particularly for detection of small polyps, but at the cost of needing to be taken off because of a fixed sigmoid in about 1 in 20 patients. We'd like to thank Gastrointestinal Endoscopy for the opportunity to put this video onto YouTube, and thank you very much for your attention.